I'm Dr. Lisa Lipschitz, and I'm one of the psychologists at West Park Healthcare Center. Today, I'm going to do a presentation on managing anxiety and depression. We all have the same basic emotions. For example, happy, sad, worry, and anger. Our emotions fluctuate throughout the day. Today, I want to focus more on anxiety and depression and how sometimes they get in the way of our everyday functioning. I will then discuss why it's important to treat anxiety and depression. And lastly, I will leave you with a couple of tools that you can try to help improve your mood. First, I'm going to focus on anxiety. Anxiety is this feeling of nervousness and worry about an imminent event coming up or something with an uncertain outcome. You may worry about whether you'll be able to cope. You may also experience physiological responses when you feel anxious, such as butterflies in your stomach, tension, tingling, tightness of the chest, and your heart beating faster. You'll probably experience difficulty breathing. When feeling anxious, we worry about whether we can handle a situation, and therefore we tend to avoid scary situations and over time isolate ourselves. I'm going to review the cycle of anxiety, which can be really important to people with lung disease. This is because you may notice with lung disease, you often worry about breathing. You may worry whether you can do the tasks you set out to do given your breathing difficulties. This, in turn, increases your level of worry. Because you are worrying, you will have a physiological reaction, such as butterflies in your stomach, tightness of the chest, tension, and difficulty breathing. You then focus on your difficulty breathing, and this perpetuates the cycle of anxiety. Now I'm going to focus on depression. Depression occurs when we're feeling really down for at least 2 weeks for most of the day. When we're sad, we start to lose interest in things we used to be interested in, such as hobbies or socializing, and we just don't feel up for doing much. Additional symptoms of depression include loss of energy, feeling fatigue, changes in appetite, difficulty sleeping, or not feeling like getting out of bed. Some people notice difficulty concentrating and making decisions, feelings of hopelessness, worthlessness, or guilt. Some people may even have thoughts of death. So why am I talking about anxiety and depression when it comes to lung disease? This is because rates of anxiety and depression are higher amongst those with lung disease compared to the general population. Anxiety and depression are higher amongst those with lung disease because when someone has lung disease, their day-to-day functioning changes. And they may have difficulty doing hobbies and tasks that they used to do. As well, tasks may take longer, and roles and responsibility change, such as not working or spending time with children. You may also socialize less often or need to ask others for help. You may notice more concern about the future and what's going to happen about your health. Because of all of these reasons, rates of depression and anxiety are higher amongst those with lung disease. There is help available, and there are things you can do to alleviate the anxiety and depression. Research has found that if you alleviate the anxiety and depression, your quality of life and health can improve. Therefore, it is recommended to treat the anxiety and depression. I'm going to review some drug and non-drug-based treatment options. If you are concerned about anxiety and depression, the first step is to talk to your doctor or a psychiatrist. Some people take medications to alleviate anxiety and depression. There are also non-drug-based interventions. For example, engaging in exercise can help. So can educating yourself and learning about anxiety and depression. It is also helpful to learn more about your illness and how you can cope with it. Reaching out for social support, either through professionals or family and friends, is beneficial. Another approach is engaging in relaxation exercises to help reduce tension. Talk therapy with a psychologist may be beneficial to talk through some of your worries and concerns. The respiratory rehabilitation program at West Park does provide all of these services, and you will learn various coping strategies. Next, I'm going to briefly discuss a type of therapy psychologists use and give you some tips to try to alleviate your anxiety and depression. Psychologists often use a cognitive behavior therapy approach, and there's lots of evidence to show that this approach helps improve anxiety and depression. This model examines how our feelings, thoughts, and behaviors are all related. You may notice that people tell you to snap out of it when you're feeling down or anxious, or just feel happier, but it is really difficult to change our emotions. This model shows that our behaviors, so what we do, and our thoughts, what we think, are all related to our emotions. And we can't control our emotions, but we can try to change them by challenging our thoughts and changing our behaviors. I'm going to review a couple of tools which focus on our behaviors and our thoughts, so in turn can potentially change your negative emotions and help you feel better. First, I'm going to focus on the behaviors. For our behaviors, I encourage you to do things that result in pleasure and joy. I recommend engaging in activities that make you feel happy. This means you may have to alter your hobbies so you're still engaging in them. I also recommend spending time with people who make you feel happy, such as family and friends. Attempting exercises can also help. To help you keep accountable and on schedule, I recommend creating a schedule and writing things down in your calendar. Research shows that you're more likely to commit to a goal if you stick to a schedule. You can also rate your emotions in your calendar in order to monitor what makes you feel happy or sad. For example, this person had a lunch date and they recorded their emotions. Their rating was an 8 out of 10 of happiness. This allows you to monitor when you're feeling happy and when you're feeling sad or anxious. With this information, you can change your schedule so that you do more things that bring you joy and try to reduce the things that bring you anxiety or sadness. Now I'm going to focus more on the thought component of the CBT model. We have thousands of automatic thoughts a day, and when we have more negative thoughts, we experience negative emotions. If you're experiencing negative emotions, the first thing that you can do is to become more aware of your thoughts. It is important to become aware of what you're saying to yourself and how these thoughts make you feel. You can then try to stop or challenge these negative thought patterns. You can do so by distracting yourself from your thoughts, by doing things such as reading a book, or listening to music, or watching a television show. You can also reach out to family and friends or professionals to get support and talk about your worries. A strategy I recommend is to try to say to yourself, what would I say to a friend of mine in the same situation? This can help you view things from a different perspective because we are often kinder to our friends than we are to ourselves. I encourage you to look at negative situations from a different perspective. Lastly, you can try to write down your thoughts, especially if you're having a lot of worries when you're trying to sleep. It may be helpful to keep a journal because it helps to get the worries out of your head and look at a situation from a different perspective. Before I wrap up, I just want to remind you of the cognitive behavior therapy model. This model examines how our feelings, behaviors, and thoughts are all related. When we are experiencing negative emotions, we can try to feel better by changing our behaviors and challenging our thoughts. Thank you.